Hello, anatomy friends. This is Dr. Alsip, and this is our first lecture where we're really getting into the regional anatomy. So we're going to talk about the actual bones and the actual joints and the actual muscles. Specifically, this first section is going to focus on the head, neck, and back. So we're going to start with bones, specifically the neurocranium. We'll talk about what that even is first off. So that's the first learning objective, trying to better understand some of these terms you may have heard, cranium, as well as skull. Sometimes they're used interchangeably. That's not quite right. There's also, many different definitions of this, but we'll talk about some of the basics there. And then lastly, we'll talk about the actual bones associated with the neurocranium and some of the features that you can actually palpate or are important both functionally as well as clinically. Okay. So the terms skull and cranium or crania, you have likely heard them your whole life. You've probably heard them or used them yourself interchangeably, and that's not quite right. So in the most basic terms, the skull means everything. So everything in terms of what is going to surround the brain, as well as the facial skeleton, and also importantly, the mandible. Now, the cranium, when you're using the definition that is used in Gray's Anatomy, which is kind of the source, this pretty much equals the neurocranium, which is what we're going to talk about in this particular video. I have here to most, though. Sometimes you hear the term cranium or crania being used to mean everything except for the mandible. So sometimes you'll hear that definition. But for our part, we're going to equate the cranium to the neurocranium, even though when talking about the viscerocranium, it does have that name right in there. So it is a confusing area. For the most part, let's just think skull is everything. Cranium is going to play a big role in terms of protecting the brain. So it's basically that bony case of the brain. And you often hear the more scientific term neurocranium. So that's the focus of this video. And the neurocranium can be split into two areas. There is the calvaria, or that dome-like roof. We often think of this or hear it referred to colloquially as the skull cap. So mostly flat kind of bones here. And then the basicranium, or the cranial base, so basically the bottom of the cranium where the brain sits. So there's a lot of foramina or holes in that region to allow for neurovasculature to travel. You will also hear the term viscerocranium, and we'll have a whole other video on those bones. Excuse me, but that is going to be the facial skeleton. So this kind of component of the skull. So our focus is going to be on the neurocranium. So let's talk about those bones. And we'll start with one of the easiest to conceptualize, which is the frontal bone. And you can see this highlighted in blue here in this anterior view. So if you think of the forehead, you think of the frontal bone. But you can also see, and in this particular image, we're going to use quite a bit throughout the course. This is looking at the base of the cranium, so the bottom, but that calvaria has been removed, and it's like you're looking into this region. So you can also see it right here. So this is the frontal bone. It is unpaired in adults, meaning that you only have one frontal bone. But during the juvenile period, it's actually two bones that will completely fuse together to form the one bone. But you may have a remnant of that frontal suture. And if the remnant persists into adulthood, that's referred to as the metopic suture. So it'd literally be like a suture line kind of running down the midline here. One of the major things that I want you to know, or one of the major structures I want you to know from the frontal bone, is an area referred to as the supraorbital margin. So supra, think above, so above the orbit. And if you can palpate kind of right above your orbit region, and you feel that it's a more substantial mounding of bone. You do have some muscle attachment here that's going to allow for that to happen. And it's really this boundary between the squamous and then this orbital part. Obviously, this is going to be the orbit. And the frontal bone is making up a good component of this region here. So it's kind of this region between the two. And you're going to have neurovasculature that's going to traverse through foramina in this region. Moving on, you are going to have paired parietal bones. And what I mean by that is you're going to have one parietal on each side. Obviously, we're looking at a lateral view, so we only see the one parietal bone. Excuse me. These are really fairly flat, certainly in comparison to some of the other bones. And they're usually fairly nondescript. You do have some muscle attachments here, but for the most part, there's not going to be any structures that I'm going to have you identify, but you have your frontal bone here, and then you'll have the parietal bones on either side. So playing a really important role in terms of that protection, obviously, of the brain and the surrounding meninges. Moving on, so whereas the parietal bone was fairly simple, the temporal bone is not. The temporal bone is a really complex bone. It is another paired bone, so there are two temporal bones. And you can really see here, if we're looking at the entirety of the skull, you're going to see just how complex this bone is in this region. This is only an external view. You can also, if you're looking at this base of the cranium superior view, you can see it highlighted here in pink. These are the temporal bones. So you can see it here, and you can also see it from an inferior view. So a fairly large bone and a really complex bone. And there are quite a few structures here that I do want you to understand. So let's start talking about them. So the first, if we're looking at this lateral view, a lateral external view, so you can see the teeth here, so we know this is more anteriorly placed, and this is more posterior. And you're going to have this process right here of almost like this beam of bone. And this is referred to as the zygomatic process. And just for your knowledge, and we'll talk about this more when we get to the visceral cranium, this bone right here is your zygomatic bone. So it is this process of bone that is heading towards the zygomatic bone. So therefore the name zygomatic process. And it's going to form the zygomatic arch, and you can really palpate it right in this region here on the side, a little bit under the orbits and kind of past the cheek region. So you can palpate this anterior to the ear. A fairly superficial region, it can be fractured in say a blow to the side of the head. And then you're going to have important muscles that kind of go underneath this region. Now, if you look at the inferior portion of the zygomatic process, you'll see that it kind of will have this inferior projection down here. And this is referred to as the articular tubercle. And this is just anterior to this region right here that we'll talk about more in a moment, called the mandibular fossa. And this is going to be the temporal portion of the temporomandibular joint, or your TMJ joint. So it's right in front. So this articular tubercle is just anterior to that mandibular fossa. So in dislocations of the temporomandibular joint, often you will see the mandible portion, which would sit kind of right up in this region, moving anterior to this articular tubercle. So generally, this articular tubercle will stop that mandibular condyle from moving too anteriorly. But in a dislocation, generally, it will kind of pop out in front of that articular tubercle. Okay. Well, let's not ignore this giant hole right here. This is referred to as the external acoustic opening, which leads into the external acoustic meatus. Sometimes you'll hear this referred to as auditory instead of acoustic, but we're talking about the same thing. Anytime you hear the term meatus, that means a passageway. Generally, it's a bony passageway, and it is here for a good amount of it. And if we think about it, if you think about it on myself, obviously I have the ear here. The ear is going to keep leading into this region, and it's going to lead into the external acoustic meatus region. So the ear would sit like right in this region here. And what this does is it allows sound waves, or the vibrations that enter into the ear, to travel through the external ear, because it's within the external ear, to reach the tympanic membrane. And you've heard the tympanic membrane before. You may not have heard it referred to as the tympanic membrane, but colloquially, we think of the tympanic membrane as the eardrum. And once you reach the eardrum, then you're entering into the middle ear. And we'll talk a little bit more about that in a moment. But this is a really important passageway in terms of allowing vibrations to reach towards the middle ear, which will eventually make its way to the inner ear to allow us to hear. Okay, so we're still on this lateral view in this region. You're going to have what's referred to as the styloid process. If you think of like the stylus that you use in terms of writing, it is going to be kind of shaped like that. And this is an inferior projection. It's inferior certainly to the external acoustic meatus here, as well as the zygomatic process. And this is going to be an important attachment point for muscles, but as well as ligaments that are associated with the tongue. You're also going to have muscles associated with the neck that are going to attach to this process. So oftentimes when you have a process, it's generally there because they're going to have some form of muscle attachment. Same as what we have with the mastoid process, but as you can see, it's a very differently shaped process than what we had with the styloid process. And you can palpate your mastoid process. So if you palpate right behind your ears, or you feel right underneath there, you should feel this kind of big bump right there. And that's the mastoid process. That's going to be kind of differently shaped in some individuals. It'll be a little bit longer or a little bit thicker. But generally, you can always palpate it. You generally can't palpate that styloid process here. And like I mentioned, with a process, oftentimes you have muscle attachments, and this is certainly the case. Very importantly, the sternocleidomastoid muscle, which is going to be right here in the neck, will have its superior attachment way up here on the mastoid process. So more to come here on the SEM. Now, if I were to open up and look internally into the mastoid process, you would see that it is fairly hollow. So there's going to be all these little hollow areas with kind of spicules of bone surrounding it. And these hollow areas are going to be referred to as mastoid air cells. You can kind of see that when you're looking at this image here, that you have all these kind of small areas here indicative of a space. And these are those mastoid air cells, and they're going to be lined by mucous membrane. And anytime that you have that type of lining, that means you can have inflammation in that region. So you can have inflammation of those air cells, which is referred to as mastoiditis. And that's often caused by middle ear infections spreading into those air cells. Generally, this isn't as common as it used to be, particularly with the advent of use of antibiotics, but that certainly can be inflamed, similar to what you have with these other paranasal sinuses. When you think of a sinus infection, it's generally going to be these, and we'll talk about these in more detail in a moment. But over here, you do still have some air cells in this region. Still not done talking about that temporal bone. It is one of the best. It's very complicated. So we are looking at an inferior view here. We can see that these are the maxillary teeth, or your upper teeth. Hard palate right here. There's that zygomatic process that we were talking about. And then just posterior to that, you're going to have this divot, or this fossa of bone. You can see the styloid process right here projecting. That is going to be the temporal portion of the temporomandibular joint. So we saw it a little bit on that lateral view. And this is articulating with the condyle of the mandible. So very important in terms of the TMJ. TMJ is one of the most important of the joints associated with the head. Looking at the base of the cranium from the superior view, again, you can kind of get an idea of where the temporal bone is located. This is the temporal bone. You'll have it the same on this other side. And you see kind of this mounding of bone, kind of rocky-like formation. And this is the petrous part of the bone. And this very top portion is the apex of the petrous part. And this is one of the coolest areas, I think, in the whole body, because within this petrous part, you're not only going to have the inner ear, which has the cochlea and the semicircular ducts that are important in terms of hearing and equilibrium, but you also have you have bones within bone. You have these ear ossicles that are located in this region as well. And some of they are the smallest bones of your body within this petrous part. So a super cool place. So let's talk a little bit about those. So just kind of getting our bearings here. So obviously this is the ear. You hear referred to as the auricle here. And then like right in this region is where you're getting into that external acoustic meatus that we were talking about. So it's kind of this tunnel of this external ear reaching the middle ear. So we're still at the external ear when we meet the eardrum or that tympanic membrane. Once you get past that, or you get more medial to it, we're in the middle ear, and then that middle ear will eventually lead towards the inner ear. And within the middle ear, you're going to have 3 bones, and they're paired. So you're going to have 3 on, say, the left side and 3 on the right side. And these, again, are your smallest bones of the body. There is the malleus. The malleus is the bone that actually is going to attach to your eardrum or tympanic membrane. This is going to articulate with the incus, which is your intermediate bone. And the incus will articulate with the stapes, which sits in an area referred to as the oval window, which leads into the inner ear. So basically, you'd have these vibrations going through here, gets to the tympanic membrane, it'll kind of go through these bones and get to the inner ear to allow for all the interesting stuff that you'll talk about when you get to the neuro portion, to allow for hearing to occur. So, but these are bones, so we do want to mention them here as well. The stapes has the honor of being the smallest bone in the body. One other thing that's associated with this petrous portion of the temporal bone is, and you can't see it very well here, but there's going to be an opening leading into a meatus, similar to what we had on the external, called the internal acoustic opening or auditory opening. And this allows, since it's sitting, if you think about the brain is sitting here during life, this allows some of those cranial nerves to actually travel through the bone in order to get to their destination. And specifically, it's 2 cranial nerves, the facial nerve, which is cranial, also referred to as cranial nerve 7, and vestibulocochlear nerve, or cranial nerve 8. And so vestibulocochlear nerve is super important in terms of hearing as well as equilibrium. So it goes into that petrous portion and it never comes out. The facial nerve goes into this portion, but it does eventually move its way out of the skull in order to go do all kinds of interesting stuff. But one of those is to innervate the muscles of facial expression that allow me to smile at you right now. Another foramen that I want you to be aware of in this region is, I have it here associated with the temporal bone, but it's actually between the temporal bone and the occipital bone. You can see this is this fairly irregularly shaped foramen or opening, and this is referred to as the jugular foramen. And it is called the jugular foramen because at this point, the venous sinuses associated within the skull, so associated with the brain in that area, are going to drain into and be called the internal jugular vein. And that's a really important vein that's going to be located in the neck. It will eventually drain and make its way down to bringing that deoxygenated blood, or mostly deoxygenated blood, back to the heart. And that's the reason why it's so irregularly shaped. Bone will form around neurovasculature. So depending on what that neurovasculature looks like, so say in this particular case, you have a very kind of oval shaped nerve that travels through this one. Well, you're going to have this vein with different pressure traveling through this region, so you have a fairly irregularly shaped foramen. You're also going to have cranial nerves that are going to exit the skull via the jugular foramen, and these are going in order, so that's nice. So cranial nerve 9, also referred to as glossopharyngeal, important in terms of the tongue as well as the pharynx. Cranial nerve 10, vagus. Ooh, you're going to talk a lot about vagus throughout the year. It's very important in terms of parasympathetics and also varying other roles in terms of the pharynx and the larynx. And then we're going to talk a little bit more about the accessory nerve, which is cranial nerve 11. It actually originates on the uppermost portions of the spinal cord and actually comes up through the jugular foramen and then almost immediately exits through the jugular foramen. But this is going to play a role in terms of innervating some specific muscles we're going to talk about. The occipital bone, think of the back of the head. So we're looking at that same view here. So if this is the frontal bone, this is the temporal bone. You have a little bit of the parietal bones here. temporal. The occipital is going to be the more posteriorly located, and you can see it here as well on the inferior side. So basically, I'm touching my occipital bone under skin in this region. And also, if you're palpating in this general region, you often will feel a bump right in the back here. And it has a really long name called the external occipital protuberance. And sometimes in individuals that have a really short haircut, you can actually see that projection or that protuberance through the skin. But oftentimes, if there's hair in that region, it's kind of blocked. But generally, you can palpate it. This is going to be an attachment site for the trapezius muscle, and the trapezius muscle, sometimes here referred to as your traps. This is going to be on the back. It's a fairly superficial muscle, but a very large muscle, and we'll talk about that in a bit more detail in some upcoming videos. Generally, the most obvious thing when we're looking at the occipital bone is this large foramen here, the foramen magnum. It's actually not the largest foramen in the body. That's going to be associated with your hip bones, but it obviously is quite large. And for me, it helps me get organized in terms of trying to differentiate certain structures. It is here in the foramen magnum that we get a transition from the brainstem, specifically the medulla oblongata, which is the most distal portion, to the spinal cord. So once you're past the foramen inferior to the foramen magnum, that's considered the spinal cord. You're going to have the vertebral arteries traversing through this region. And then again, as I mentioned, you're going to have that accessory nerve, or cranial nerve 11, that's going to come off of the spinal cord, come up through the foramen magnum, and then almost immediately exit the skull again via the jugular foramen. If we're looking at an inferior view, so again, you can see the foramen magnum with this inferior view as well. On either side of the foramen magnum, you have this kind of smooth area that looks like they're kind of sitting on pedestals. And these are the occipital condyles. This is where you're going to have the articulation between the skull and the vertebral column, specifically your first cervical vertebrae, which we often will see abbreviated as C1. And this forms these condyles will form the atlanto-occipital joints. So you get the occipital part, it's of the occipital bone. The atlanto is because sometimes C1 is referred to as the atlas, okay? So you kind of think of the atlas held the world on the shoulders. Well, that's what C1 is doing, holding the world that is the skull. All right, my all-time favorite bone of the body, the sphenoid. The sphenoid is wonderfully complex. You can see it here in this illustration, so completely removed from the surrounding bones. It looks like this kind of winged structure, butterfly type structure. So if you're looking at this, this is an illustration of that same superior view of the basocranium. You can see it located here. You can see it from an inferior view. And then you can also see it from this lateral view here. You can see a little bit of that sphenoid here. Now, in this region, you're going to have a lot of foramina, so a lot of means by which neurovasculature travels through this region. Oh, and one thing I forgot to mention is that there is only one sphenoid bone. It is not paired. So some of the more important ones that I do want you to understand, I'm not going to have you know every single foramen, even though it may feel like I do. I'm not, believe me. Right here, you can see these two openings leading into a canal, and these are the optic canals. And as the name would suggest, it allows for the optic nerve to traverse this region. Very important in terms of vision. It also allows the ophthalmic artery to travel through and go supply things that are associated with the orbit. Right in this region, kind of right behind it, you're going to have this fairly substantial divot, almost saddle-like type of fossa, which is referred to as the hypophyseal fossa. You see, I have two different spellings here. This is the actual correct one here. We should put an I right here. So this is the hypophyseal fossa, and it's called that because another name for the pituitary gland is the hypophysis, okay? And so really what is sitting right here during life is the pituitary gland. An extremely important gland. You're going to talk about this in more detail when you get to the endocrine portion of the course, but it's sitting here in this fairly well protected region not only is it kind of associated with the brain, but it's being protected by all this bone surrounding it. One other opening I want you to be aware of that's associated with the sphenoid bone is the superior orbital fissure. It's of the sphenoid bone. You can see a little bit of it peeking out here underneath the lesser wing of the sphenoid. You can see it quite a bit clearer in this anterior view looking into the orbit. It's called a fissure because it's this wider opening. You can see a bit of the optic canal right here. And it's going to allow a lot of stuff to go through there. You're going to have the oculomotor nerve, which is cranial nerve 3, trochlear nerve, cranial nerve 4, and the abducens nerve, cranial nerve 6. And then one of the 3 divisions of the trigeminal nerve. The trigeminal nerve is your largest cranial nerve, and it's divided into 3 divisions. And this first division goes through here. So we'll talk about these in more detail, and you'll talk about them in the neuro portion of the course. But one thing I want you to get is that all of these things that are traveling through this superior orbital fissure are going to the orbit. For the most part, many of these are going to the orbit in order to innervate extraocular eye muscles that will move the eye around. It will provide sensory innervation to this region as well, specifically when we're talking about this ophthalmic division of trigeminal nerve. So all these things are going to the orbit or leaving the orbit. And last but not least, in terms of the bones we're going to discuss with the viscerocranium is the ethmoid bone. Sometimes the ethmoid bone gets put with the facial skeleton, but there's some overlap here, so we're going to mention it here. So again, let's kind of get our bearings. You see the frontal bone here. You see the sphenoid bone that we just talked about, temporal bone, occipital bone, a bit of the parietals right here and right here. And then right here, kind of hanging out in the middle, is the ethmoid bone. And so this is if you thought the sphenoid bone was complex, this ethmoid bone, look at it over here. It is quite interesting in terms of what it looks like. And it's usually quite deep. If you're looking at this anterior view here, you wouldn't just see the ethmoid bone. It's going to be a little bit deeper within the skull. You can see it here. And what's notable in this particular view of the ethmoid is you have all these like small holes all over the place associated with the ethmoid bone. And these are referred to as the cribriform foramina. And this is a hugely important area because if I were to go right underneath the ethmoid bone, I'm basically in this nasal cavity. And so what happens here with these cribriform foramina is it allows the axons, so these small portions of the olfactory nerve, to kind of traverse through these cribriform foramina on the way back to the brain. So it's sending signals in terms of olfaction or smell to be interpreted by the brain. So a super cool bone. We'll talk about it a little bit more with the viscerocranium as well, but we're going to introduce it here. All right, excellent. There's quite a bit there. We're not even done with all the bones of the skull, so there's a lot going on here. So take a moment to kind of go through those structures that I talked about. If I talked about a specific structure, I usually gave you a reasoning behind why I want you to know that structure. So if something attaches there or something goes through there, make sure you understand those relationships because those are the types of things that often get tested on. All right, so our question: which structure of the temporal bone has air cells within? Is it the articular tubercle, internal acoustic meatus, mandibular fossa, mastoid process, styloid process? What do you think? If you need to, pause the video. But when you're ready, I hope that you have landed on the mastoid process. So remember that process that you can palpate on yourself underneath the ear, or kind of posterior to the ear. It is a larger process. It is an area where you do have muscle attachments, but within the mastoid process, you have fairly prominent air cells throughout. The styloid process is much too small in order to have these air cells. Internal acoustic meatus, not so much. It's going to kind of tunnel into that petrous portion of the temporal bone, allowing the vestibulocochlear and the facial nerves to travel through there. The articular tubercle, again, a little on the too small side to have these air cells. That's going to be that inferior projection associated with the zygomatic process, important in terms of dislocations of the TMJ. And last but not least, not the mandibular fossa either. This is going to be the T in the TMJ, so the temporal portion of the temporomandibular joint. All right, excellent. So take your time to kind of go through this. Realize you're going to get to see these structures as well in lab, and I will be ever so happy to answer any questions that may come up. Thanks for your time.